Clearly, there are issues which our health system needs to work out. Let's take a look at some of the major problems facing our U.S. healthcare system. One of the biggest issues facing our system right now is poor access to care. First, you have individuals that still don't have health insurance. They have some of the most difficult times actually accessing care. Where do they end up going? Well, to hospitals for emergency care. The year the Affordable Care Act was passed, hospitals provided about $40 billion in what they consider uncompensated care. That is, care they're not paid for. That was nearly 6% of their total 2010 expenses. So why do they have to do that? Well, there was a 1985 federal law that requires emergency departments to stabilize and treat anyone entering the doors, regardless of their ability to pay. This doesn't mean that hospitals won't still try to bill the person without insurance. Often these bills are sent to collection agencies, and the bills tend to be higher for an uninsured patient than an insured patient because there's no carrier to negotiate their prices. Ultimately, for the bills that go unpaid, hospitals compensate by charging other patients with insurance more. Next, we have people that are underinsured. Plans changed drastically after the ACA was put in effect, limiting plans for only catastrophic care or short-term plans. Further, it changed pre-existing condition exclusions. Yet, high deductibles today make it so that some people, even if they have insurance, may not be able to use it when the time comes because they can't afford the high deductible. Additionally, there are concerns of portability. Will your plan even be offered in a state should you have to move? Finally, for the publicly insured, as we discussed earlier, low reimbursement rates to doctors, basically 75 cents on the dollar or something lower, leads many doctors and medical services to be restricted and cuts the access for the poor. Although post-ACA, the number of the uninsured has gone down, even amongst private industry workers, there's still problems with access to care. Although related to poor access of care, the largest problem facing our healthcare system right now is the growing costs. These costs affect all individuals, employers, and levels of government. Healthcare continues to become more expensive, and for the individual, remember, most individuals can't even absorb a $400 hit, and sends many individuals into bankruptcy. Further, post-ACA, high deductible plans are making it more and more difficult for individuals to actually receive health insurance, and then actually make use of that health insurance when they need care. While large businesses traditionally offered health insurance, post-ACA, there was an employer mandate that requires employers of 50 or more full-time employees to offer health insurance to at least 95% of their full-time employees, that is, employees who work 30 or more hours a week. This is putting a significant burden on many medium-sized companies as well. Small employers, in this case those with fewer than 50 full-time equivalent employees, are exempt from coverage requirements and penalties. Finally, there's a growing burden on the government to provide in the relationship to growing costs. As Medicaid was expanded post-ACA for single adults, more individuals took advantage of this and have received public assistance. Growing costs and more individuals under the plan equals a larger bill for the individual governments. As healthcare costs continue to rise, ultimately, what we spend out of our gross domestic product on healthcare each year continues to rise with it. This ultimately means less money for the government to spend on other services which we enjoy and demand, puts restrictions on employers from hiring more individuals and growing, and restricts disposable income for individuals to stimulate the economy.